Welcome to week 3. Today we are going to discuss different options to use for smoking cessation. Have you set your quit date? There are 4 steps we go through when deciding to quit: debate, create, state, and celebrate. Have you set your quit date? If so, have you thought about satisfactory milestones to celebrate? Will you treat yourself to something special after a particular time frame? You really should. Remember this slide? We are on the last letter of our acronym for this program. T, talk to your doctor. If you have other health issues, such as cardiovascular disease, you should ask for your physician's opinion regarding the best options for you with the least risks and side effects. Now that you have decided to quit smoking, it's time to choose your method. Let's discuss smoking cessation methods further. There are several methods available to assist in smoking cessation. Each person is different, and what works well for one may not work for someone else. Quitting cold turkey works for some, but overall it is not a successful way to quit smoking. Fewer than 5% of people quit this way, as many are unprepared to handle withdrawal symptoms that eventually trigger an intense urge to smoke. Likely you will find more success with an assisted quit method. Nicotine gum is over-the-counter and can be expensive. Even though the price between this over-the-counter medication and a month's worth of cigarettes are pretty close to equal, some people might have a difficult time paying the price. Side effects of the nicotine gum can include mouth sores, throat irritation, jaw pain, hiccups, dyspepsia, increased salivation, flatulence, nausea and vomiting, an unpleasant taste, and lightheadedness. Even more expensive than nicotine gum, lozenges cost the same as if you were a 2-pack-a-day smoker. Side effects include nausea, hiccups, cough, heartburn, and headaches. The patch is much more reasonably priced. However, there may be issues with the patch sticking to the skin. If the skin becomes sweaty, how well will it stay in place? Will the patch cause skin irritation? Side effects of the patch include local skin reaction, headaches, and sleep disturbances. There are several prescription medications which may be an option for you. If you believe one of these medications may be the best option, please discuss it further with your family physician. One such medication is the Nicotine Inhaler. Dosing for the Nicotine Inhaler includes 6 to 16 cartridges per day initially for at least the first 3 to 6 weeks. Treat for 3 months and then taper use over the next 3 months. Cost can be $780 per month, but some insurances may pick up this. Side effects can include mouth and throat irritation, unpleasant taste, cough, rhinitis, dyspepsia, and headaches. Pros to this medication include that it does satisfy the need to have something in your hand. It is safe to use if you have cardiovascular disease, and may be used in combination with Zyban. Cons for this medication include that it can be expensive if not covered by insurance. Ambient temperature delivery of nicotine from the inhaler declines as temperatures below 40 degrees. You must avoid the use of acidic beverages for 15 minutes before and after use, because it can interfere with the absorption of the medication. A second prescription option is Wellbutrin, or Zyban. This medication is dosed at 150 milligrams by mouth twice a day for 8 to 12 weeks. Maintenance therapy can be up to 6 months. Cost for this medication is $80 per month, but some insurances may pay for this. Side effects can include insomnia, dry mouth, nervousness, agitation, anxiety, weight loss, constipation, and seizures. Pros for this medication include that it can be combined safely with nicotine replacement therapy. It may benefit patients with a diagnosis of depression, and there is no tapering required for this medication. Cons for this medication include that it may increase your seizure risk. It may also increase suicidal thinking in those with depression. The final first-line medication we will discuss is Chantix. Chantix is dosed at 1 milligram by mouth twice daily for 12 weeks. If at the end of the 12 weeks a person has been successful in quitting smoking, they may continue for an additional 12 weeks on the medication. Cost for the drug is approximately $200 per month, but may be covered by insurance. Side effects can include nausea, insomnia, abnormal dreams, headaches, dyspepsia, constipation, flatulence, and vomiting. Pros for this medication include that it does provide nicotine effects to reduce withdrawal symptoms and cravings, and blocks nicotine effects from smoking to decrease rewards from smoking. It may be used in those who suffer from cardiovascular disease. It has no significant drug-drug interactions and may be more effective than Zyban. Cons include that it has not been studied in combination with nicotine replacement therapy, so may increase side effects. It can have dose-dependent nausea. It does not reduce weight gain, impaired ability to operate heavy machinery, and may cause neuropsychotic symptoms. There are several second-line agents that may be options for individuals who are unable to use first-line medications because of contraindications, tolerability issues, or failed first-line therapies. Clonidine is a second-line medication that we will discuss further. Oral dosing for Clonidine is 0.1 to 0.4 milligrams per day in 2 to 3 divided doses. The transdermal patch dosage is 0.1 milligrams over 24 hours and is applied once weekly for 3 to 6 weeks. Cost is $106 per month and may be covered by insurance. Side effects can include dry mouth, sedation, dizziness, constipation, and low blood pressure. Elderly patients may be more sensitive to the side effects, especially sedation and hypotension, so they may have to reduce their dose. The final prescription medication we will discuss is Nortriptyline. Nortriptyline is dosed at 25 milligrams daily, increasing gradually to a target dose of 75 to 100 milligrams daily. Duration of treatment used in smoking cessation trials has been approximately 12 weeks, but the drug may be used for up to 6 months. Initiate therapy 10 to 28 days prior to your quit date to allow the drug to reach steady state at the target dose. Cost is approximately $24 per month, but may be covered by insurance. Side effects can include sedation, dry mouth, blurred vision, urinary retention, lightheadedness, and shaky hands. It may also impair your ability to operate heavy machinery. Use caution with patients who have cardiovascular disease or patients on MAO inhibitors. We have covered the different medication options, both over-the-counter and prescription. Let's explore a few other options. Many smokers are able to quit with support provided by individual counseling or group treatment. Counseling can help you identify and overcome situations that trigger the urge to smoke. Support groups provide encouragement through regularly scheduled meetings with persons who are also attempting to quit. Research shows that success rates for all quit methods are substantially higher when combined with a support program such as counseling, group meetings, or quit lines. Quit lines are free, telephone-based counseling programs that are available nationwide. When you contact a quit line, you are introduced to a trained counselor who can assist you in developing a strategy for quitting as well as help to motivate you to continue the method you have chosen. In many cases, counselors can provide material that improve your chances of quitting. The combination of counseling and medication is more effective for smoking cessation than either medication or counseling alone. Medications alone have an average abstinence rate of 21.7%. Medications in combination with counseling have an average abstinence rate of 27.6%. Higher numbers of counseling sessions in combination with medications produce the highest abstinence rates. One session can be 21.8%, 2 to 3 sessions is 28%, 4 to 8 sessions is 26.9%, and more than 8 sessions is 32.5%. There are other interventions for smoking cessation, however there is insufficient evidence found to actually evaluate the effectiveness of other types of counseling and behavioral therapies such as those listed on this slide. I'm sure many of you have seen and heard about electronic cigarettes. The jury is definitely still out. There's no published study available that tells us that e-cigarettes are any better than traditional cigarettes. So now that you know what methods are available, how do you decide which one is right for you? Ask yourself the following 10 questions. Do you feel you would benefit the most from over-the-counter medications, prescription drugs, or even a combination of these methods? Have you tried to quit in the past and found that one method absolutely did not work for you, but maybe you had more success with a different method? Which option would work best for your day-to-day life? If you are going to be uncomfortable using the Nicotine Inhaler around family and friends, it might not be the best choice for you. Consider each option and choose the one that best suits your lifestyle. Are you a heavy or light smoker? Be honest with yourself when asking these questions. It will be important to use the appropriate dose of nicotine replacement therapy, depending on your daily smoking habits. The reason for the differences in effectiveness for males and females is not completely understood, but it may have something to do with the levels of the hormone progesterone. The study found higher levels of progesterone were associated with a lower number of available nicotine receptors, suggesting progesterone may indirectly block these receptors. Making good dietary choices and getting regular exercise will help prevent weight gain as you quit smoking. Are you concerned about depression, or do you have a diagnosis of depression? Zyban and Nortriptyline, in combination with nicotine replacement therapy, appear to be effective in individuals with a history of depression. Do you have a history of cardiovascular disease? The nicotine patch has been demonstrated to be safe for individuals with a history of cardiovascular disease. Do you plan to use your method long-term? Long-term use is helpful in smokers who have persistent withdrawal symptoms during the course of their medication, have relapsed in the past after stopping the medication, or for those who desire long-term therapy. A minority of smokers successfully quit using nicotine replacement medications on an as-needed basis for long-term. The use of nicotine replacement for up to 6 months does not present a known health risk, and dependence is uncommon. The FDA has approved the use of Zyban, Chantix, and some nicotine replacement therapies for up to 6 months. Should you feel the need to continue the use of nicotine replacement therapy for greater than the recommended time, please consult with your physician first. Are you considering combination therapy? Combined use of the nicotine patch long-term with nicotine gum or nicotine nasal spray, nicotine patch with nicotine inhaler, or nicotine patch with Zyban increases long-term abstinence rates when compared with a placebo. Combining Chantix with nicotine replacement therapy has been documented to increase side effects, primarily nausea and headaches. Thank you for participating in Week 3 of Strong Lungs, Strong Life Smoking Cessation Program. Today we learned about the different methods that may be used. Use this information to decide which is best for you. If you think combination therapy would be best, please contact your family doctor. Thank you, and I hope to see you for Week 4.